Hi, my name is Dr. Nate Pennell. I'm a medical oncologist at the Cleveland Clinic Taussig Cancer Institute in Cleveland, Ohio. I run the lung cancer medical oncology program here. This morning I'm going to talk about liquid biopsies, or also known as plasma testing for T790M positive EGFR mutant non-small cell lung cancer. So we know that epidermal growth factor receptor mutant lung cancer represents about 10 to 15% of patients with lung adenocarcinoma. And we know that when we identify these mutations, that we have effective treatments for them with drugs like Taussig, Iressa, Gilitrif, and Tagrisso. However, even though these drugs work very well for patients with EGFR mutant lung cancer, sooner or later patients develop what's called acquired resistance, which means even though they initially respond, they eventually begin to progress and their cancer begins to worsen. And we also know that in about half of those cases, the reason the cancer has become resistant to those drugs is that it has acquired a new mutation, a second mutation called T790M. The reason this is important is that if you detect the T790M, we have drugs that are actually effective for those patients. Specifically, the drug osimertinib or Tagrisso is approved for patients with T790M positive lung cancer. The rub is you actually have to biopsy the cancer that's getting worse on the original treatment in order to identify that T790M mutation. The traditional way to do this, of course, is to put a needle into the cancer, look at it under the microscope, do molecular testing, and identify the mutation. But that has risks, it takes time, and of course it's not always feasible or even possible to reach the cancer that's progressing in order to do the biopsy. Wouldn't it be great if you could just do a blood test and actually detect the T790M? Well, it turns out you can. Through a blood test, or so-called plasma testing, we know that you can detect DNA from the progressing cancer, and if T790M is positive, you can detect that in the blood. There's a FDA-approved test called the COBAS test, which is available in many commercial labs, but many labs also have their own independently developed tests. And then many of the major companies that do testing are also able to do these plasma testing. So why aren't we doing this in everyone? Well, it's not a perfect test. So we know that it's very reliable. If you detect T790M in the blood, you can actually use that to treat people, and they tend to respond to drugs like Tagrisso. So it's real when you detect it. The problem is it's not perfectly sensitive. And sometimes you may miss a real T790M mutation because there just simply isn't enough DNA in the blood to detect it. Not every cancer sheds their DNA, and sometimes there just isn't enough cancer for it to be there at a high enough level to detect. So if you test someone and it's positive, then you can use that. But if it's negative, you can't trust that it's truly negative, and then you have to go on to a tissue biopsy to detect it afterwards. I do think, though, because it is so fast, it usually only takes 48 hours, 72 hours to get a result from a blood test, that it's very reasonable in someone who's progressing on a drug like Taussig or Iressa or Gilitrif to do the blood test to detect T790M, and only if it comes back negative do you need to go on to a tissue biopsy.